Hi, I'm Richard. I'm a speech and language therapist and a lecturer based in the UK. In today's video, I'm going to discuss applying for a degree in speech and language therapy. I'll discuss things applicants should know or consider doing before applying, things they might want to include in their personal statement, and how they might answer questions during an interview. I hope this video will be useful to people considering speech and language therapy as a career and anyone interested in learning more about the profession in general. I'm making this video for a couple of reasons. First, as a speech and language therapist and a lecturer, I have a vested interest in making sure that people interested in speech and language therapy know as much as possible about the profession and course before they apply. Second, it is often difficult for applicants to get experience shadowing or working directly with a speech and language therapist, so I want to make sure that applicants have easy access to good quality information to learn about what speech and language therapists do if they cannot speak to one in person. Finally, and building upon the last point, I've noticed a worrying trend in the UK where some individuals and organisations are charging people interested in studying speech and language therapy to attend online courses to learn more about the profession, speak to several therapists working in different clinical areas, and in some cases to meet service users. These sound like excellent opportunities, but I think they should be provided free of charge to anyone interested. Otherwise, it creates additional barriers for applicants to access good quality information, and it will put those not able to afford these at a disadvantage when writing their personal statement, answering questions at an interview, and ultimately whether they receive an offer compared to other applicants who can afford to pay for these opportunities. The kinds of people who will go on to become speech and language therapists will be less diverse, and the profession will suffer as a result. Let us start with one of the most important things you need to demonstrate when writing your personal statement or answering questions during an interview. You need to demonstrate that you understand what speech and language therapists do on a day-to-day basis. You can learn this kind of information by shadowing or speaking to a speech and language therapist, watching a day in the life videos on social media, and by looking at the careers pages on the NHS and Royal College of Speech and Language Therapists websites. In short, speech and language therapists assess, diagnose and treat people with communication and swallowing difficulties, also known as dysphagia. How a speech and language therapist assesses a client or patient will depend upon their age, cultural background, suspected difficulty and current presentation, etc. They might use informal assessments such as observing a client in a natural setting. For example, observing how a young child interacts with other children and their teacher in a nursery. Are they interacting with others, or do they seem to play alone? Do they make verbal requests when another child is playing with their favourite toy? Do they wait, or do they take it forcibly without asking and upset others? They might take a sample of someone's language when talking to them. For example, asking someone who has had a stroke questions and then writing down what they say and how they say it to see if there are any patterns. Does the person seem to struggle to produce words? Do they say the correct word but it is less clear than usual? Or do they use the wrong word and their communication partner has to guess or infer what they are trying to say? Does the patient know when they have not said the right word? And do they use any other forms of communication such as non-verbal gestures? They might complete a rating scale or checklist about someone's communication, or ask the client or patient themselves to fill something out, or ask their family members for their opinion about how it impacts them. For example, asking someone whose voice does not sound normal how this impacts their quality of life from a functional, physical and emotional perspective. Do they have any difficulties at work because of their voice disorder? Is their throat sore when they speak? And is their voice difficulty making them feel depressed? Speech and language therapists might also use standardised assessments, which include formal tasks that have often been tested on lots of other children and adults. Some who are typically developing or have no communication difficulties or dysphagia, and some who do, to get a sense of what normal variation looks like. Completing standardised assessments allows them to compare the results against these norms to see if the client or patient has any difficulties, what kinds of difficulties specifically, what strengths they have, and what support they might need going forward. For example, asking a child to listen to a word or sentence, then point to the correct picture from a choice of 3 or 4 pictures, which includes other pictures that might distract them if they do not understand the words correctly or are just guessing. This might allow the speech and language therapist to learn what kind of verbal language the child understands. Do they understand less than other children the same age? Do they have particular difficulty understanding certain kinds of words or sentences, etc.? They may ask an elderly patient who is not swallowing as well as they used to and keeps getting chest infections to drink and eat whilst having a video fluoroscopy, VF, sometimes also known as a swallow study. The VF uses X-rays to show how effectively you swallow. This might allow the speech and language therapist to learn which muscles are not as strong as they used to be, or whether they are not working together in a coordinated way, so bits of drinking food are going down into the airway unnoticed and not stimulating a normal reflex to cough it back up. After completing assessment, the speech and language therapist will decide whether there is a communication difficulty or dysphagia present, what kind specifically, and whether it is likely to be short-term or long-term, whether it is likely to get better with treatment or continue to get steadily worse over time due to its progressive nature. Once they've done this, they can consider a wide range of treatment options to support the client or patient to increase their understanding of the difficulty, reduce the negative effect of the difficulty, or provide therapy to improve it or stop it getting worse for as long as possible if it's progressive in nature. This could involve speaking to the client or patient and giving them advice or information, giving them activities or exercises to complete on their own, asking them to work with others with similar difficulties in a group, or having individual sessions with the speech and language therapist where they complete specific exercises and tasks to target particular difficulties or learn new skills, etc. Sometimes a therapist can use an existing off-the-shelf activity or program, but they might also need to develop bespoke therapy materials from scratch to meet the needs of an individual client or patient. Speech and language therapists also spend a lot of time working with people close to the client or patient. This could be their parents, family members, or friends. This could also be professionals such as Senkos or teachers in a school, dietitians or nurses in a hospital, etc. The speech and language therapist might give these people information, advice, or training about how best to support the client or patient to communicate or eat and drink more effectively. For example, the speech and language therapist might assess what someone with a learning disability living in a care home understands and advise the support workers looking after them how best to adapt their communication so the client can understand more of what they say. The speech and language therapist might inform a dietitian that a patient's swallowing has been reviewed and they have improved so they can swallow drinks of a normal thin consistency more safely, which means the dietitian can suggest using a wider range of supplements to meet the patient's nutritional needs. Whilst completing assessments, delivering therapy, and speaking to others close to the client or patient makes up a large portion of what most speech and language therapists do on a day-to-day basis, it is not the only thing they do. It is just as important for applicants to know that speech and language therapists, like most other professionals, have to complete a wide range of tasks that do not involve direct contact with the client or patient. Some of these might still be related to the client or patient, such as collecting a case history before seeing them, writing case notes about the session you've just completed, speaking to others about what happened in the session, such as to give them an update, creating resources or therapy materials for a future session, writing reports summarising the results of an assessment they have just completed with the client, or how much progress they have made since they were initially assessed or reviewed. It could also include completing paperwork or telephoning other speech and language therapists to refer the client or patient to another service if they are moving from one setting to another, such as a patient leaving hospital. They might also potentially have to speak to or make referrals to other professionals to make sure the client or patient's broader needs are met. For example, making a referral to clinical psychology if you notice that the client or patient is feeling depressed. Speech and language therapists also attend meetings such as handovers on a ward in the morning, or specific meetings about individual clients or patients, such as an annual education, health and care plan review for children to check their progress against goals set the previous year, etc. Sometimes these are with other members of staff, sometimes they are with the client or patient themselves, as well as their family or friends, depending upon the purpose of the meeting. Beyond this, there are more general tasks such as answering queries on the telephone or by email, triaging new clients or patients to decide who needs to be seen, how quickly, and by whom, attending team meetings with other speech and language therapists or other professionals in the service, providing and/or receiving supervision, completing continuing professional development, also known as CPD, such as reading articles, completing training or a course, or going to a conference, etc., to make sure they know the most up-to-date way to assess and treat their clients and patients. Most speech and language therapists also regularly take speech and language therapy students on placement. A few work as lecturers and teach students at university. Some carry out audits and research to help identify the best way to provide care for clients or patients they work with, and increase the evidence base for all speech and language therapists generally. Finally, a few will manage whole teams of speech and language therapists. They will make sure that their services have enough staff to try and meet the needs of their clients or patients in their area. They conduct interviews, make sure existing staff are up to date with their training requirements and take annual leave, deal with complaints about the service, and often have to collect data about how well the service is running and meeting the needs of clients or patients. They might write reports and make bids to try and acquire more funding for new services to better meet the needs of the service's clients or patients. What each speech and language therapist does will differ depending upon the service they work in, who they work with and alongside, and how experienced they are. It's important for you to demonstrate that you understand the wide range of clients or patients that speech and language therapists could work with, as you'll be trained to potentially work with all client groups on the degree. There is a common misconception that speech and language therapists only work with young children to improve their speech, which is only a small part of what speech and language therapists do. You can learn more about which kinds of clients or patients speech and language therapists work with by shadowing or speaking to a speech and language therapist working in different services, reading articles, books or websites, by watching documentaries, or by looking at the Royal College of Speech and Language Therapists website. One of the most important factors to recognise is that speech and language therapists work with people with communication difficulties, as the job title suggests, but also people with swallowing difficulties, also known as dysphagia. One approach to consider when thinking about who speech and language therapists work with is thinking about different client or patient groups in terms of a lifespan, working to support the feeding skills of premature babies at one end of the lifespan to those in end-of-life care at the other end. If you can think about different client or patient groups along this lifespan, then you will get a good sense of who we work with as a profession. In childhood, we often work with children who have developmental language disorder, speech sound difficulties, selective mutism, and those who stammer. Other groups of children we might work with include those with a cleft lip and palate, hearing impairment, autism, and children who have English as an additional language, etc. In adolescence and early adulthood, we might work with people who are suspected of or who have committed criminal offences. In adulthood, we often work with people who have acquired communication difficulties and dysphagia. This could include sudden presentations such as a stroke or traumatic brain injury. There are conditions that are sometimes more gradual, such as infections, brain tumours and head and neck cancer. Then there are more progressive conditions such as dementia, Huntington's disease, motor neuron disease and Parkinson's disease, etc. Across the whole lifespan, we might work with people with mental health difficulties. Often people go on to develop mental health difficulties because they find it difficult to communicate effectively and eat and drink normally. Sometimes the medication they are given to improve their mental health can actually have a negative impact upon their communication and swallowing. Finally, one group of clients or patients that is sometimes not mentioned as often as others is children and adults with learning disabilities, despite making up a significant proportion of the speech and language therapy caseload. They are made up of people with known genetic and chromosomal causes such as Down syndrome, Fragile X syndrome, Prader-Willi syndrome, and Rett syndrome. Sometimes there are non-genetic factors such as complications during pregnancy or birth, which might cause conditions such as cerebral palsy or fetal alcohol spectrum disorder, for example. Therapists working with people with learning disabilities can often get to know these clients very well and work with them over long periods of time, which can be extremely rewarding. You should also be aware of the wide range of settings where speech and language therapists can work. You can learn about where speech and language therapists work by shadowing or speaking to one, watching a day in the life videos on social media, watching documentaries, or by looking at the Royal College of Speech and Language Therapists website. The kinds of places that speech and language therapists commonly work include nurseries, schools, hospitals, rehabilitation units, in people's own home, in care or residential homes, in community clinics, psychiatric hospitals, prisons, and in university clinics, etc. Some speech and language therapists also offer telehealth services which allow them to work from home. Where each speech and language therapist works will differ depending upon who they work with, which service they work in, and whether they work in the public or private sector. You should consider the kinds of skills that speech and language therapists have, whether you have some of these already, and how you might develop the ones you do not have in the future. You can learn this kind of information by shadowing or speaking to a speech and language therapist, or by watching videos on social media. In short, some of the skills that speech and language therapists typically have include excellent spoken and written communication skills, so they can adapt how they interact with others to meet the needs of the client or patient they are working with, or their family members or other professionals. They are usually very caring, compassionate, and empathetic, as they often work with very vulnerable clients or patients going through distressing situations. It is important to recognise that having a communication difficulty often makes clients or patients vulnerable, as they find it more difficult to advocate for themselves or express how they are feeling. You need to be resilient, as you might work in challenging environments or with distressing situations, or give potentially upsetting news on a regular basis. This often reflects the importance of good communication skills and normal swallowing to people's everyday quality of life. You also need to be aware of how this is likely to impact your own mental health and well-being, and reflect on what you can do to look after yourself to avoid being overwhelmed or burning out. Do you know when you are stressed or what this looks like? Do you have any strategies you use to combat this when you are studying or working now? Do you find it difficult to unwind or separate your work and personal life? Speech and language therapists must also reassure and motivate clients or patients through difficult periods, especially when progress with their communication or swallowing is slower than clients would like. So they need to remain positive and solution-focused to encourage the client or patient. Speech and language therapists are often very analytical and good problem solvers, as they regularly complete assessments, listening and observing for signs and symptoms to identify and diagnose different communication and swallowing difficulties, and suggest strategies to help someone very quickly. This often involves thinking creatively or outside the box, as there is not always a standard approach that can be used for every client or patient. Speech and language therapists need to be able to work independently and also often in a team, whether it be with other speech and language therapists when completing instrumental assessments of swallowing, such as a video fluoroscopy, or with other members of the multidisciplinary team, such as completing an autism assessment with a psychologist or testing eye gaze technology with an occupational therapist. This often means you need to be flexible and able to negotiate well to get the best outcomes for the client or patient. Like with most healthcare professionals, speech and language therapists also need to have good organisational and time management skills so they can effectively prioritise their workload to make sure clinical and non-clinical tasks described before are completed on time, or to seek help from others in a timely manner. Finally, speech and language therapists should be reflective so they can learn from situations where things have not gone to plan, and also to ensure when something has worked well that they know why, so they can keep doing more of that in the future with other clients and patients. This list is not exhaustive, but gives you an idea of the kinds of skills that most speech and language therapists regularly use. You should be aware of what is involved in studying speech and language therapy at university. You can learn this kind of information by searching on university websites for details of the course and the modules you'll complete each year, by speaking to university staff or current students while attending an open day, or by checking online community or social media websites such as Blue Sky, Reddit, Twitter, or the Student Room. In short, the kinds of subjects that speech and language therapy students will learn on the degree include anatomy and physiology, linguistics and phonetics, multilingualism, different areas of psychology such as developmental and neuropsychology, and how these apply to speech and language therapy, typical child development and aging across the lifespan. They will also learn about different speech, language and communication disorders, as well as dysphagia, how to assess and treat each of these conditions, professional skills such as advanced communication skills, cultural diversity, and reflective practice. And last but not least, research methods and ethics. The exact structure of the degree will vary from one course to the next, but generally these topics will be covered at some point. The teaching methods used will also be broadly similar. You will have formal lectures, workshops and tutorials in university to learn and practice new skills such as transcribing speech, analysing language, critically appraising research papers, analysing data and statistics, etc. When it comes to learning more practical clinical skills, you might complete simulations with your peers or experts by experience who are often clients with communication difficulties who have significant experience supporting students' learning. You might have interprofessional learning opportunities where you complete sessions with students from other professional backgrounds such as education, psychology or other healthcare professions. You will have clinical placements either in the university or in a wide range of external settings mentioned previously with practice and speech and language therapists. As the course progresses, you will complete more work independently, your placements will become longer, and you may have the opportunity to complete a research proposal or dissertation project to get more hands-on experience with research methods. Now that we've covered some of the basics about the profession, let us consider what you bring as an applicant and what you might want to consider mentioning when writing a personal statement or discussing during an interview. One of the most important things to consider mentioning is whether you have any personal experience of communication difficulties and/or dysphagia. This could be if you have or have had a communication difficulty or dysphagia yourself. I've worked with or know of speech and language therapists who were autistic, who was selectively mute, had a cleft lip and palate, a stammer, and speech difficulties. If you have had or have a communication difficulty and/or dysphagia, you have first-hand knowledge of what it's like to experience this. Can you reflect on this and draw any conclusions? How did or how does it feel to live with it on a day-to-day basis? How did others respond to you and treat you? Were there any challenges? Did you feel stigmatized? Did you receive speech and language therapy yourself? If you did, how did it feel to be a service user or patient? Did the therapist do anything to reassure you? Did they make sessions fun if you were a child and include you in decision making, etc. if you were an adult? Did receiving speech and language therapy make a difference to your life, and if so, in what ways? Did your communication or swallowing improve? Or was it more about giving you the confidence and strategies to live well? More fundamentally, do you feel having or having had a communication difficulty and/or dysphagia allows you to better understand the needs of the clients you might work with going forwards? Do you feel you can empathise with them more than another therapist who does not have the same kind of personal experience? Do you feel it gives you more buy-in or credibility in the eyes of the client? Is this something that you would readily share with them to establish rapport? Alternatively, do you feel that this is presumptuous and your experience does not necessarily make you any better qualified to work with clients or patients because everyone is different? Other relevant kinds of personal experience would be if you have a family member, friend or acquaintance who has had or has a communication difficulty and/or dysphagia as well. This could be, say, if you're a parent whose child receives speech and language therapy, or if an older family member suffered a stroke or has dementia. Perhaps a work colleague had an accident and you watched them struggle to return to work, etc. Did the speech and language therapy you received or you saw your family, friend or work colleague receive affect your decision to become a speech and language therapist yourself? It's important to stress here that your experience does not necessarily have to be positive. If you received or saw poor quality care or kinds of therapy that you dislike or disagree with, that can be just as powerful a motivator in wanting to train to be a speech therapist, so you can provide a different, better quality of care to clients or patients in the future than you received yourself or saw others receive. Another important thing to consider mentioning in your personal statement or during an interview is what academic qualifications you have or what courses you are currently doing that are relevant to the degree. Speech and language therapy draws upon a wide range of knowledge and skills, so there are lots of subjects that you could study that are potentially relevant and worth mentioning. The kinds of broad subjects that are generally appropriate include child development, education, English language and literature, food science and nutrition, foreign languages, health and social care, maths, music, psychology, sciences such as biology, chemistry and physics, and sociology. Picking the right subjects is only the first step, however. Once you've done that, you need to explain what specifically you have learned from these subjects and how this relates to or prepares you to study speech and language therapy at university. I will give a few examples to demonstrate what I mean. If you are studying a Level 3 diploma in childcare and education, you could discuss several of the units you have studied, such as child development from conception to 7 years and understanding children's additional needs. You could talk about how having a good understanding of normal child development allows you to better understand what typical development looks like and how children with developmental difficulties are different, etc. If you're studying an A-level in maths, you could highlight several of the topics or units you have studied, such as statistics, data presentation and interpretation, probability and hypothesis testing. You could talk about how having a good understanding of maths equips you to read and understand academic papers and the evidence base that speech and language therapy is built upon, so you can select the best kinds of assessments and therapy for the clients or patients you work with and take part in research in the future. These are just 2 examples. Being able to identify which parts of your course or qualification are relevant and communicate this in a clear way is a skill and depends upon your knowledge of what you will study on the speech and language therapy degree discussed above. It is also important to highlight if you have completed any relevant short courses or training more broadly. This could be in-house training you completed whilst working as a speech and language therapy assistant or nursing assistant on a ward, such as health and safety, safeguarding, the Oliver McGowan training on autism and learning disabilities. It could be a Makaton or British Sign Language course that you completed as an evening class at your local college. Or it could be an effective communication skills for professionals course you completed on a MOOC such as Coursera or FutureLearn. It's important to mention any kind of learning that you have done that you think is relevant, even if it was done outside of a qualification or course, especially if it demonstrates that you've completed independent learning that prepares you for the degree. For example, you could have watched a YouTube video where Professor Steven Pinker talks about linguistics being a window to understanding the brain. Maybe you watched a documentary on the BBC by Louis Theroux on people who have suffered an acquired brain injury, or documentaries on Netflix about abuse scandals around the use of facilitated communication with people with learning disabilities, etc. This is all useful learning. Learning independently is a big part of studying at university and something that all speech and language therapists will continue to do for the rest of their professional lives. The final thing to mention in your personal statement or during an interview is any relevant paid work you have or have done, any relevant work experience or volunteering that you've completed to prepare yourself for the degree. The best kind of work experience that you can have is to work as a speech and language therapy assistant, as you will work directly alongside speech and language therapists on a daily basis, so you will develop a really good understanding of their role, how they work with assistants, and the kind of work they do. Unfortunately, there are not that many speech and language therapy assistant jobs available, so most applicants do not have the opportunity to gain this direct experience. Other kinds of relevant work experience will be jobs where you routinely work with speech and language therapists as part of your role. This could be if you are a nursery or teaching assistant in a school working with children with speech, language and communication needs. You could also work as a care or nursing assistant in a care home or a hospital, working with adults with communication difficulties and or dysphagia. You have hands-on experience both working with the client or patient themselves, supporting them with their difficulties, and also working with the speech and language therapist in a professional context. Think about how they interacted with you. What kinds of questions did they ask you? Did they expect you to follow a set of guidelines about how best to interact with or to support the client or patient to communicate or eat? Were you involved in the development of these guidelines by suggesting what strategies you had already tried, what you found the most useful so far, and which did not work? Or did you feel that the therapist did not include you in this process and collaborate as an equal partner? The last kind of relevant work experience is any paid work or volunteering for an organisation which supports clients or patients with communication difficulties and or dysphagia. There are lots of relevant charities in the UK, such as the Alzheimer's Society, the Cleft Lip and Palate Association, Headway, which is a charity for people with acquired brain injuries, Stammer, and the Stroke Association, to name a few. All of these charities offer a range of opportunities to support the broader work of the charity as a whole, as well as specific opportunities that are very relevant to a potential applicant, such as volunteering to help run a support group for people with aphasia, where you get hands-on experience interacting with and supporting people communicate more effectively. Most hospitals have formal volunteering programs in place. Some link these to opportunities to gain formal shadowing and work experience with clinicians too. My local NHS Acute Trust even provides a mentor who supports people on their volunteering programme, and they offer CV writing workshops, interview skills seminars, Ask the Expert Q&As, and support with personal statements and job applications. From a paediatric perspective, you could get in touch with local nurseries or schools, the local council, local children's groups such as Brownies, Cubs, Scouts. You could potentially help out in a classroom, read to children, tutor, support a homework club to gain more experience. There are lots of opportunities and support out there if you know where to look. There are lots of work experience and volunteering opportunities that I have not mentioned simply because there are too many to list. It is highly unlikely that you have no relevant work experience at all. It is more common that applicants have some experience, but they do not consider this to be relevant because they do not know enough about the profession and why their experiences or skills are transferable to speech and language therapy. Almost every job or volunteering role requires the use of spoken and written communication skills in some description. Being able to work with others, whether it is other volunteers, permanent members of staff, or members of the public. Using organisational, time management and problem-solving skills in some capacity, etc. I will give an example to demonstrate what I mean. Say you work in a cafe at the weekend or in the school holidays. Think about the range of customers you deal with. Do you speak to children the same way you do to their parents? What about older customers who might have a mild hearing impairment? I guess that you will probably subtly change your verbal and non-verbal communication throughout these interactions without necessarily reflecting upon what you are doing and why. Here you are demonstrating active listening skills in a busy working environment. By repeating back their order, you are showing attention to detail so the customer's order is correct and delivered on time without mistake. Perhaps you are demonstrating patience with someone who takes longer to order or needs support to read the menu. Do your customers ever ask about allergies, specials on the board, about halal, vegetarian or vegan options, or what you would recommend personally? If they do, here you're demonstrating adaptability. Do customers ever require different plates or cutlery? So do some people with dysphagia. Are the customers ever dissatisfied with their food or drink? Do they become upset or angry and want to make a complaint? So do some patients and clients. Here, you are learning how to manage conflict and negotiation skills to get the best outcome for everyone involved. This is a relatively short example, but you could expand on it and talk about communication differences when talking to your colleagues or employer, when you answer the telephone, respond to written messages on social media or over email, perhaps writing advertisements on boards to attract customers, how you work as a team, etc. If anyone has work experience but they are not sure how it could relate to speech and language therapy, then leave a comment below and I will offer a few suggestions. Now that we've talked about the profession and what personal, educational and work experiences that you might have, I will now give you a few top tips about how you might answer questions in an interview and how you might complete activities individually or as part of a group. First, do not assume that the person or people interviewing you have read your personal statement or know anything about you or your background. The application form tends to decide whether you are shortlisted for an interview, but it is your performance during the interview that is often what determines if you receive an offer or not. This means when answering questions, you can draw heavily on the information you've already provided on your application form or in your personal statement. In some cases, questions might be scored individually, so you can perhaps repeat an example from a previous question too. If in doubt, you can always ask your interviewer whether this is acceptable. Second, prepare answers for common interview questions such as why you want to become a speech and language therapist, what makes you suited for the career, Can you give an example of a time when you've worked in a team, a time when something has not gone well, etc.? Consider whether you can structure your answer to make it easy for the listener to follow and for you to demonstrate what you learned from the situation. A common approach that is often recommended for interviews is the STAR technique, where you describe the situation, explain what the task or problem was, explain what actions you took, and what was the result and/or your reflection from this. Third, prepare answers for questions where you might need to show some awareness of professional standards and wider frameworks that speech and language therapists tend to work under. For example, the Health and Care Professions Council Standards of Proficiency, the NHS Constitution, the 6 values of the NHS, the 6 C's, etc. Fourth, interviews are nerve-wracking for most applicants, so see if you can arrange practice interviews with a teacher, careers advisor, friend or family member to get comfortable talking about yourself and your experiences. Some generic questions are available online to use, or you can use AI to help generate new ones. You could consider doing this online on Teams or Zoom and recording yourself to watch back to review your own performance. Did you answer the question that was asked? Did you give a clear example? Did you explain what you learned from the situation and what you might try to do differently next time? Do you have any mannerisms or certain phrases that you tend to overuse when nervous? Fifth, if you are asked to complete an activity individually, then the focus is likely to be on your communication and observational skills. For example, being asked to make observations whilst watching a video of a person with communication difficulties, then writing this down and feeding this back to an interviewer afterwards. Another example might be listening to someone with a speech disorder and trying to transcribe or write down what you think they said. This might feel like a daunting task to complete or unfair, as this is effectively what you'll be learning to do on the course itself. But have a go. Think about how you can approach this task systematically. If it's observing someone with communication difficulties, think about the different kinds of communication you can have and how this can be broken down. For example, you could have broad categories like verbal and non-verbal communication. You could have categories like listening, speaking, reading and writing. Whatever categories you use, do you get a rough sense of what they are like in each of these different areas? For example, they appear to understand what the other person said because they answered the question appropriately. They seem to have some difficulty with their talking because I could see them struggling to get their words out. Their sentences were shorter and less grammatical, and I wrote down a few examples where they used the wrong word, e.g. they meant to say that they had 2 cats at home, but they said 2 dogs instead. Sixth, if you are asked to complete an activity as part of a group, then the focus is likely to be on your communication skills and teamworking skills. It might feel awkward working with others that you're essentially competing for a spot on the course with, but the interviewers need to know how well you work with others, given that you will be regularly completing group work on the course with them, might complete a peer placement with one or more of them, and go on to work in a multidisciplinary team environment when you graduate. Consider what groups you have worked with in the past, or when you've been asked to complete group work previously. When did it go well? Did you know why it worked well? Did you allocate set roles? Did you break the task into smaller pieces and work in smaller groups? Are you someone who naturally likes working in a team, or do you feel like it is sometimes difficult to voice your own opinion and you get crowded out? The best kinds of team players are those that are comfortable voicing their views, but, more importantly, help facilitate others to be involved too, so there is a healthy balance in the group. Finally, if you're asked to complete an activity with an expert by experience, then the focus is likely to be on your communication and people skills generally. Be genuine. If you are asked to interact with someone who has had a stroke and has aphasia, but you've never met anyone with aphasia before because most of your experience has been with children, then be honest about this. Show genuine curiosity about the other person and ask them questions. Tell them about yourself, because this is what speech and language therapists do to build rapport with clients and patients on a day-to-day basis. Most importantly, do not pretend that you understand them when you do not. The expert by experience and interviewers will be far more impressed by a candidate who is honest and says they did not understand what the expert by experience said or meant. Ask them to repeat themselves or attempt to clarify, or ask what kinds of strategies they find useful to get their message across and attempt to use these strategies with them. It shows an openness and a willingness to learn. If you found this video useful, give it a like and subscribe to receive notifications about similar videos in the future. If you have any comments or questions, then let me know in the comments below or get in touch with me on Blue Sky or Twitter. Otherwise, thanks for watching and take care.